Hello and welcome back to our Avalon podcast series. I'm the host, Mariah, and today we are joined with a very, very special guest, Dr. Shokat Fatteh. Um, just a quick little brief introduction on of his amazing accomplishments. For over 40 years, Dr. Fatteh has focused on teaching and practicing medicine. After earning his degree from India's Baroda Medical College in 1975, he then wanted to work as a doctor in the US and started his pathology residency in New York City in 1976. This goal began to take place, and after completing his residency successfully, might I add, Dr. Fateh was awarded a highly sought after fellowship program in dermatopathology in New York, which is honestly very, very, very hard to get into. So, hats off to you, Dr. Fateh. And as it is a highly competitive specialty for pathologists specifically, but after his fellowship ended, he relocated to Youngstown, Ohio, and that is currently where he resides and where the whole idea of Avalon started essentially. So, Dr. Fateh, what accreditations does Avalon have that make it stand out?
Well, let me start with thanking you.
Of
I think it was
course.
a very good introduction, and I love it.
Thank
It's
you.
flattering, but I appreciate that.
Thank you.
I think when I'll have to give you some history, Mariah,
Mhm.
before we get into accreditation because it's
Absolutely.
kind of a cut and dry. Uh, the whole idea behind having a medical school that I wanted to start was to educate students
Hmm.
and educate students to a point where they're good enough to practice anywhere in the world. And I think being a student, you probably know
Yes.
our education is quite comprehensive, quite extensive. Now let's go to accreditation. I think if you look at the Caribbean medical school structure,
Hmm.
there are over 80 medical schools in the Caribbean,
Oh.
and only 15 to 16 are accredited.
Oh, wow. Okay.
What is so important about accreditation is because that is what is required to practice in the United States.
Hmm.
So if you ever want to do that, students who are anywhere in the world, they can practice if they
Hmm.
pass the qualifying exams, and you know those exams. So, step one, step two, whatever, they have to have an accredited medical school.
Absolutely.
That's what we have. Now, not only we have an accreditation with one entity, but we have it for two.
Oh, okay.
The one is called CAAM-HP, which is a Caribbean accrediting agency. The other one is called ACCM,
Hmm.
that is from Ireland.
Oh, okay.
And there are only two medical schools in the Caribbean which have both accreditations.
Hmm.
And I might add, Maria, that we are the only one which has a maximum accreditation of 4 years and 6 years of the
Wow.
school. So
Okay.
we are very proud of what we have achieved.
Yes, and I feel
And
very honored to be a student. Yes.
I don't want to boast, but you should be.
Yes.
But not only that, but I think we were talking about it just before the
Hmm.
podcast that we also have an accreditation process which we hope to get. We are very confident that we'll
Hmm.
get it for New York State. They have
Hmm.
a separate accrediting process, and we're going to get that. I'm pretty confident about that. We already have California. So, in other words, almost all the states in the United States, our graduate can go and practice.
That's amazing. And how successful are Avalon graduates after they leave, would you say?
What is that?
After they leave, the Avalon graduates.
What about them?
How successful would you say they are?
They are, if I give you the numbers, you'll be amazed. There are more than 500.
Oh.
Actually, as of last week, 600 of our graduates practicing in the United States already.
Oh, wow. Okay.
So success rate is very high,
Hmm.
and there are numerous more throughout the world.
Hmm.
For example, over 150 to 200 in India.
Oh, okay.
There are
Yes,
quite
yes.
a few in the Middle East, Nigeria, and even in Europe.
Hmm.
So once you get the residency,
Hmm.
which is the most critical part, they are able to secure very good locations and practice opportunities. So our success rate is very good.
I can see that based on those
Yes.
numbers. So why do you think specifically at Avalon small class sizes matter the most?
Well, you have seen that, so it's very easy to explain it to you, but
Yes.
I need to explain it to people who may be watching this.
Hmm.
It's like having every student access to every professor, and you can verify that.
Yes.
The doors are open. We call it open door policy. You knock
Hmm.
on the door and you go and see the professor. That is possible only with small class size.
Hmm.
Not only that, but every professor will know your name,
That is true.
one on one, all the professors. And
Hmm.
believe me, as a chancellor, I may not know the name, but I make sure that they do.
Yes.
So once in a while, randomly, I check with them. Who is that student? And if they say don't know, then there is a problem. So in other words, the small class size reflects into one-on-one education and also personal touch. There is a mentorship program where a professor is assigned to a particular student, and they actually, you can go to him for not just the the course they are teaching, but also about
Mhm.
personal issues.
Absolutely.
So small class size matter.
I'm a big believer in small
Yeah,
class sizes, as you just say.
happy to
Like,
hear that.
I have been experiencing this firsthand, and I do really appreciate I'm going to use the word intimacy almost, that you can go to your teacher and you can feel confident in what you're saying, and you can feel confident that you will get answers and that you will be helped in some way. So I
That's
really
great. Good to
appreciate
hear
that.
that.
And where do students complete their clinical rotations as of now?
There are three locations where they
Hmm.
can go and do the core rotations,
Hmm.
which are the main ones, the surgery, medicine. I don't want to bore people with that.
Yes.
There are six of them, and those are West Virginia.
Mm.
Second one is Chicago, and the third one is in Phoenix, Arizona. That's where they can do core rotations. For electives, they can pick the hospitals or locations they like. As a matter of fact, you can go to Calgary and do some elective rotations, you
Yes.
being from Calgary.
Of course.
So,
Sidebar.
those are electives where you can pick anything. But the accrediting bodies require that we do our core rotations
Hmm.
in the locations where they have visited and have approved. And these are the three: West Virginia, Chicago, and Phoenix.
Yes, and what's special would you say about specifically at Avalon, the faculty and the facilities that we have to offer?
I think if you look at our staff, and I'm glad that you are here because it's easy to talk to a student rather than somebody who is
Absolutely.
not. And I can give you an example. Like I had an interview with Curacao Chronicle
Mhm.
a few years back. You may want to see that.
I,
But the person was the owner of Curacao Chronicle, and he was not a student. So he would not appreciate what I'm going to say.
yes,
The professors are
absolutely.
all experts in their field. They are either PhDs or MDs in their
Mhm.
field. So every one of them have vast experience, not only in learning but also teaching in the field they are in.
Mhm.
That makes a big difference.
Absolutely. And what's it like whenever you do come to Curacao and visit? What's it like seeing campus, being on campus, perhaps living on campus in your experience?
Yeah, that's a very loaded question, but I love it. That is the bottom line. I look forward to coming back here. I live in Ohio, as you
Hmm.
mentioned already. So I come here in the winter. That's a selfish reason because then I can avoid the cold of Ohio.
Best of both
But at the
worlds.
same time, if I'm here for 2 to 3 months, that's what I stay here in the winter.
Hmm.
I attend lectures of the new professors,
Hmm.
and then I give feedback to the deans as to what I think about the professor and what we can improve about it. But at the same time, when I mingle with the students, and as you know that I'm walking around and I'm
Yes.
with the students like a student, and that is the most exciting part.
Hmm.
It's uh, it's my product, and I feel
Yes.
very proud of being. It's like having a baby.
Yes.
I have two children, and this is my third child.
Hmm.
I love it when I'm with the students and I see the environment and the camaraderie that's going on between the students, and love it.
And then my last question for you
Yeah.
is, how does Avalon prepare students to be great or excellent doctors?
Well, education is number one,
Absolutely.
discipline is number two.
Mhm.
And if I have to say something, I guess this is ending.
Mm.
I want to create or graduate doctors in my school who would be able to treat me.
Oh, I
Does that
like
make
that.
sense?
I like that. Yes.
I want to be them to be so good that I feel I'll be very confident that they can
Hmm.
treat me. And at 75, I need treatment, and that's what I look for. Every one of them need to be that good to treat me, and I think we have
Absolutely.
produced them. My practical example is that my primary care physician in Ohio, he is my student.
Really?
Yeah,
I had no idea.
yes, and there are other experts who give me advice for my diabetes, and I
Mhm.
don't make it look like I'm a chronic patient, but they're all either physicians that are graduated from my school,
Hmm.
or I'm talking about the school in Ohio,
Yes.
or they're residents working in the
Hmm.
hospital, so I knew them very well. And that is the kind of training I want to give to my students.
Hmm. Well, I appreciate you coming today, Dr. Fateh. I know you're very busy, so I appreciate you coming and sitting on the podcast. Thank you so much for being here and thank you for answering all the questions. I know me being a student, I probably knew most of those answers, but for whoever is not and whoever would like to, you know, get a little bit more knowledge, and you are very knowledgeable. So it is a pleasure to sit here with you
Thank you. It
today.
was a pleasure having you.
Thank
It
you
was
so
fun.
much.
Thanks.
This is the first episode of our podcast series, so stay tuned for our next episode where we will be interviewing Dr. Samir Fateh. Thank you so much for joining us today, and see you guys next time.